Assalamu alaikum and good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. As always, it's wonderful, to have this time of the week to be talking about health issues. There are so many health issues that we tend to sweep under the carpet, we tend to ignore them until they actually present themselves. And then we run helter and skelter to all sorts of doctors. And the main thing we hear from doctors is, you could have prevented this if you had this, if you'd made these sort of changes in your lifestyle. Today's topic, extremely important, affects everybody. Heart issues, issues related to the heart disease, cardiology, and for that, it's our great privilege to have with us in the studios today. You've taken out the time for us. Thank you very much, Major General Retired Azher Kayani, who is the Executive Director of the Rawalpindi Institute of Cardiology. You have also had the privilege of being personal physician to the President and the Prime Minister of Pakistan. Thank you very much for being with us here today.
And thank you very much for inviting me.
What we're going to do now is have a look at a report, and then we will turn to our expert.
Heart attack or myocardial infarction is caused due to coronary artery blockage. Coronary arteries are the blood vessels which supply the heart with oxygen and nutrition. Over time, the inside of these arteries develop fibrofatty plaques of different sizes. These plaques are made of cholesterol and other substances floating through the bloodstream, such as inflammatory cells, proteins, and calcium. Many of the plaque deposits are hard on the outside and soft on the inside. The hard surface can crack or tear, exposing the soft, fatty inside. When this happens, platelets come to the area, and blood clots form around the plaque. The artery narrows further, and in turn there is less room for blood to flow through the arteries. Finally, this results in the occlusion of the coronary arteries, resulting in the death of the surrounding heart muscles.
Okay, welcome back. We hope you found that helpful. Dr. Kayani, when we go to hospitals, whether they're government hospitals or private hospitals, there's a huge number of people when we talk about heart-related issues. How much of a disease burden is it in Pakistan, and has it been rising alarmingly? It is.
I think it has become an epidemic now. 30% of the population has the heart problem, and it's growing every year. And this is the disease which is #1 killer in the world, and we've got more mortality because of this disease. But the good thing is at the same time it is highly preventable, but just by the diet and lifestyle modifications. The mortality is so much that this is #1 killer in the world, and the 80% of that mortality and that burden is in this part of the world, South Asia, which includes Pakistan, India, China, Bhutan, Nepal, Bangladesh. And this is more rampant in this part of the reason being that in our population genetically we have got small arteries which have got small dia, and this disease comes to this part of the world 10 to 15 years earlier than the Western population.
Right.
And when it comes, it is more virulent and it's more malignant, and there's more deaths and more complication as compared to the population in the West. So I think we have to be very, very careful. I think the initial message is that you eat less and exercise more. That's way you can keep your arteries clean and you can avoid this disease. I said earlier that this is a #1 killer, but at the same time it's a highly preventable disease.
That's true. And as you're saying, eat less and exercise more. I mean, how much more simple can that be?
Yes, as simple as possible. I think more of vegetables, more of fruit, and more of fiber, and less of meat and less of oily things. And I think one should go for a simple kind of a diet. You should have the vegetables the maximum, and then especially the kind of legumes and dal we have in our diet. Those should be the main part of your diet. And if you at all want to have a meat, it should not be more than 3 times in a week, and should be white meat, preferably white meat.
Preferably white meat,
and the poultry, preferably if you're a heart patient, it should be poultry without skin, and the fish without skin, because that skin contains some fat and cholesterol as well.
Of course.
So in that way you can reduce your intake of cholesterol and fat.
So how do you sort of counsel your patient? Because our part of the world is, you know, we're in love with our food, and the taste buds they demand all this spicy stuff, and you have the typical niharis and things like that.
Hey.
So how do you sort of, you know, get people to understand that it's all about balance?
That's really very difficult to convince the people, because they live for the food and they don't, I think, take food for a living. That's the most important thing. You'll be shocked to know that since I go and see my patient in the emergency every day in the morning, I'm in the hospital at 7:30 in the morning, and you are shocked to see young lads in their 20s and 30s with a heart attack lying in your coronary care units, in the intensive care units. And you are really shocked. And their family and their near and dears, they refuse to believe that they had a problem. You have to convince them. It takes extra effort to convince them that this is a heart problem. They had the heart attack. And this was the main issue is the diet. The unhealthy diet, they take a lot of fat, nihari, then puri, chana.
And then not burning at all?
Not burning at all. Sleeping all the time, no physical activity, no exercise. I mean, if you just start walking, that's a simple exercise. Just a simple walk.
Costs nothing.
It's nothing, costs you nothing. And if you can't walk, at least use the bicycle.
Right.
That's kind of an exercise you can always have instead of using the motorized kind of a sport.
Of course.
You can have the bicycle and you can burn your calories and reduce your fat. And if at all, when you eat all these things, and this is the kind of a diet we have, and especially, once in a while is fine, but if you take it every day. I had two youngsters who were in their, one was 22, another was 26. And when they came to us with a heart attack, and first they were very reluctant, because they took some time to come to our hospital, because they thought this can't be heart at their age. So went to some other hospital, and then the doctor advised them, it seems that you are having a heart attack, and it's better you go to the Rawalpindi Institute of Cardiology. So they came to us and came to know that they have been having this nihari and puri for the last 2 weeks without any break. And no exercise, and doing 2 or 3 jobs at one time. That physical exhaustion, mental exhaustion,
stress,
and then the unhealthy diet.
It all combined.
It all combined together, and then we did the angiography, and we wanted to do the angioplasty, because now the treatment in vogue is that you immediately, when someone has a heart attack, you immediately take him to the angiography room, do the angiography, and there is a blockage. You open up with a balloon, and then you put in a stent and do the angioplasty. We call it a primary angioplasty. And this program we are running in the Rawalpindi Institute of Cardiology. So we took them to the cath lab, and we did the angiogram and saw their arteries. There was hardly any blockage, and it was all fat clogging the coronary arteries, and behind that fat there was a clot. So when there is a fine fat getting absorbed into the blood, it makes the blood sludge. And that hardly flows through the coronary arteries, stagnates over there, and that causes the blockage of the coronary artery, and that makes the blood clot. And then it stays there for some time and gets resolved, and there is no blockage. But that has done the damage. The heart attack means your muscle dies, your heart muscle dies.
Right.
And we can't bring it back. So that's a permanent damage.
So, you know, as you're saying, so even just a few weeks of neglect or a few weeks of that can bring on a heart attack. That diet.
Even if in your normal diet, if you start having the binges on the food and the fatty food and taking every day, and there's no break in between to get that absorbed, or then make the blood thin and let the blood take some time to thin, then there is a chance, every chance with minor blockages, you're going to have a heart attack.
And then add to that stress and other compounding factors.
Right.
Okay, so this is really, really important advice that, you know, Dr. Kayani is giving us. And he's saying that, you know, you don't have to be a person with history of a lot of years behind you. You can be young, and it's just, you know, about how you're treating yourself. This is really important. Dr. Kayani, please tell us, when a person presents themselves to an emergency room with chest pains, what then happens? How is a heart attack diagnosed, or heart disease?
I think the chest pain which comes on exertion, which comes on any kind of activity. If you are walking, you are climbing stairs, or you are lifting some heavy objects, or you are having kind of argument, heated argument, and you're losing your temperament, become emotional, and that brings on, and the moment you stop that thing, that activity, it goes away. That's your heart. Don't ignore it.
But then if you're getting emotional and you're getting anxious, and that gives you chest pain, can that also...
Yes, that can also be there, because that may be the first indication that you're going to have this heart problem in the future, are going to have an attack. This is the first indication. You better stop that activity and then get yourself diagnosed, have the appropriate tests and get it diagnosed and get the proper treatment.
Okay. You were talking about, you know, the patients that you were saying, the young ones that were in your CCU, and you talked about angiography and angioplasty. What's the difference between them?
The angiography is the test which actually looks into the coronary arteries. And these arteries are lying on the surface of the heart, and these are the arteries which provide nutrition to the heart. And once they get blocked, then you get the angina, the heart attack.
Right.
So those arteries are blocked, and then you get a chest pain. Once you do a test, this is the gold standard. The angiography is a gold standard test. This is the test which tells you 100% whether the disease is there or not, and what is the intensity of the disease, whether it's a mild, it's a moderate, or it's severe, and what kind of treatment you would advise to the patient, depending upon the severity of the disease. If it's a mild one, you go with the prescription and give medicine to the patient. And if it's more than that, then if you need some kind of ballooning or stenting, you do the angioplasty. Angioplasty is the treatment.
It's a treatment.
Angiography is the diagnostic test, just to diagnose the disease.
Right. What symptoms, if a person is, you know, having those symptoms, do they need to contact the emergency room and go there immediately? What are the symptoms?
I think the earlier you reach the emergency, the better it is for you, because the treatment, if it starts early, then you're able to save the muscle. And you lose the time, you lose the second, you lose the minute, you lose the muscle. So it's better always, whenever you have a chest pain, immediately go to the nearest cardiac hospital.
Right.
Not other hospital, because if you go to the other hospital, they will not be able to diagnose the disease, number one. Number, if at all they're able to diagnose, they will not be able to treat you, and they'll refer you to the cardiac hospital. You are losing that time.
Right.
So that time is really very important, because that time is muscle. So you are losing your muscle. So immediately go to the nearest cardiac hospital where you spend less time traveling, and get the treatment over there. And if you get this chest pain while you are asleep, and especially you get this heart attack at the early hours of the morning, especially after 12 o'clock, 2, 3 or 4 a.m., that's always a heart, unless proven otherwise by the cardiac hospital.
Right, okay. And the symptoms of pain in your left arm, that seems to be something that...
Yeah, I think sometimes you have some kind of very unusual feeling. Sometimes it is just a pain, very excruciating pain, very severe pain in the chest and the center of the chest, going to the both sides of the chest, or just going to the left arm, or going to the both arms, or going to the back, to your this between the shoulders area, and going to your neck and lower jaw, and then maybe a sweating, or maybe a nausea or vomiting, maybe you pass out, things like that. Those are really very important, and maybe sometimes it comes for a few minutes and goes away, but sometimes it persists. If it is more than 20 or 30 minutes, you have a massive heart attack, and you can have some kind of a rhythm problem. Your heart may stop beating, and you may die. So the earlier...
Something that is so important.
It is very important.
So, you know, what Dr. Sam's telling us is that you have to take notice of some... Many times we think, you know, oh, okay, you're having this pain, it will go away, and you ignore it. But these are things not to be ignored. And as Dr. Kayani is telling us, you know, it can cost you, literally cost you a life. Tell us about, we were talking before the program, you were talking about life-saving emergency kit. And I thought that is a fantastic piece of advice, especially for somebody who's at home, there's no medical expertise nearby at that moment. What does a person do?
That's really a very important thing. Actually, these are simple medicines that are already being used by the cardiac patients. And this kind of emergency kit I devised, and it contains few simple things. And I think so before I show you this medical kit, it's very important that out of all the patients who have heart attack, only 60% they make to the hospital. 40% die before reaching the hospital.
Okay.
So those are the lucky ones who manage to reach the hospital and get their treatment. So it's very important, without losing a second or a minute, the moment you have symptoms, immediately rush to the nearby hospital. And if you can't rush and you have any issue, then I have got this emergency kit with me, and I think should show it. It's only cost you, I think, 40 to 50 rupees. Not more than that.
Right.
And if you have a chest pain and you think that you may be having a heart attack, then this is the normal Disprin tablet.
Right.
Like you can get anywhere from a medical store or general store.
Right.
And you immediately take one tablet.
In water?
No. You crush it and take it.
Crush it and
if you crush it and take it, then it has a faster action.
Crush
and
that
in
and
the
take
15,
that.
20 minutes. And then for chest pain, you can have this Angicid. And everyone who has a heart problem, I think he is very familiar with this tablet. Angicid, you put it on the tank, and if there is some blockage or if the arteries collapse, it open up the arteries and restores the flow of the blood.
Right.
So this is really very important.
Right, okay.
Another third thing which is nowadays not available in the market, is to disappear from the market, is a patch. This patch is a deponent patch or a nitroderm patch. It's a 5 milligram patch.
Okay.
It contains medicine which open up the arteries. You just peel it off, and there are two parts of the plastic. One is the softer one, the other was the harder one.
Okay.
The softer part you stick on the chest.
All right.
Anywhere on the chest, preferably in the males, if you in the axilla where there are no hair, and ladies can stick it anywhere they like. And when it's there in the chest, the medicine gets absorbed through the skin, goes into the blood circulation, and goes and open up the artery. And by that time, I think you have started your treatment at home, and now you start traveling to the hospital. And by the time you reach the hospital, you may have treated yourself.
I see.
So, and you may,
that's how important that is.
This is very important.
Right.
And before you reach the hospital, maybe your pain is not there, and your circulation is restored, and that heart attack is gone. And if there is going to be a heart attack, you may have a limited damage.
Right.
So that it controls the damage as well. And if you're going to have some kind of a rhythm problem, it can treat your rhythm problem, and you may save your life. So this thing is really very important wherever you're working.
Definitely.
Yes, not only for you, but the people around you.
Your loved ones, family, even a stranger.
This is a simple one.
Save somebody's life by just that simple.
It's very simple. It's very simple. And I would recommend that everyone should have this kind of an emergency kit at their place, in their wallet, in their cars, at their place.
Exactly.
At their working place.
In a wallet, in a handbag. So this, again, very, very important advice, this emergency kit that Dr. Kayani has been telling us about. Do carry this around with you in your car, in your handbag, in your wallet. You just never know at home. You just never know when you might need it. It's something that is life-saving. Again, we talk about awareness. We talk about prevention. How do we instill that culture in our country?
That is really important. I think you don't get convinced till the time it strikes you. And if you're you, then you come to know, oh, this is the heart attack. So I think this thing is really very, very important. When the patient comes to us in the hospital, he is the most receptive at that time. And we try to educate and instill this thing to them. And someone in the family with a heart problem, and they've seen that happening, and they've seen that treatment, and they've seen the cost of the treatment, and the cost of diagnosing the problem, they immediately convince, yes, this is something, and they should prevent it, and they should follow the do's and don'ts, so they don't have this problem. So this is very important, that, and no age is immune. Starting from 20s onwards, you can have that. And somebody, if you have a disease in your family, there's a 50% chance that other family members can have this problem.
Is that the same for male and female?
Both for males and females. Initially, the females in our setup, I think they were naturally protected because of the hormones. They have naturally hormones which they work against the clot formation. But nowadays, the females who have overweight, who don't exercise, and they've got bad dietary habits, and that they can have this problem earlier. We are getting now females in 30s and 40s with a heart attack. And especially those... And
that's not an age you would think.
It's not. Normally, you expect this disease in ladies after 45 years of age or something like that, not before that. But now in the hospital, daily, if you see the ladies, they're in 30s and 40s, and mostly they are overweight, they don't exercise, they have a poor diet. And then if they are diabetic and hypertensive, they don't control their diabetes or hypertension. Because if sugar is not controlled, if you are diabetic and you're a diabetic patient, and your sugar is not controlled, your blood is thicker than the other people.
I see.
And that thickness causes the clot formation, and that blocks the coronary arteries.
Right.
So 80% of the diabetics who are not controlled, they get the heart problem. 80% of the diabetics who do not control their sugar, they get the heart problem. So this thing is very important to control your sugar, and the same goes for the blood pressure people. Those who do not control their blood pressure, and their blood pressure remains more than 140 or 90, the upper limit is 140 over 90. If it's more than that, you are more liable to get the heart attack and stroke, the paralysis.
Again.
And you can bleed in your eyes, and you can lose the sight, and you can damage your kidney and get the kidney failure. These things are really very important. I think these diseases are not disturbing, but not to control them brings a lot of complications and makes your life miserable. And you become disabled with these diseases.
Yeah, and to, you know, as you're saying again and again on the program, as Dr. Kayani is saying, that these things are all preventable. So many things are preventable by your lifestyle, your diet, also your sleep.
Yeah, that's a very important thing. The sleep is that at least you should have 6 to 8 hours sleep in 24 hours.
What happens when you're not?
You're not, then I think you go into kind of exhaustion and you get this problem earlier than you are expected. Reason being, if your artery is blocked 30 or 40% and you're not expected to have a heart attack, the blood is flowing through that blockage and you're getting the necessary supply of blood to the muscle. But once you lose your sleep and get exhausted, then the artery it collapses.
Okay.
And then the 40% is the blockage or 30% is the blockage and the 60% is the collapse of the vessel because of the exhaustion and the poor sleep. And then that transitory kind of a collapse causes the blood to clot over there and block the artery and cause the heart attack. And then after the heart attack occurs, then it may dissolve, the clot may dissolve by itself because of the natural process. And then when you do the coronary angiography, the blockage is not that much where you have to put in a stent, but you have done the damage to yourself.
To yourself.
That's preventable. And you can live with that kind of blockage for another 15, 20 years without having the heart attack. So this is very important whenever you have symptoms, and whenever you have chest pain exertion or mild exertion, and whenever you have symptoms on poor sleep, please correct those things and rectify those things, and you will not have this heart problem.
No.
But if you keep on doing things, there's no respite in between, then this can lead to a severe heart attack and you may lose your life.
Imagine these things. I mean, that we, you know, at the back of our mind, we know we're doing these things. Subconsciously, we realize if we're not getting enough sleep, we realize if we're eating too much junk food, we realize if we're taking too much stress. But unfortunately, it's when it actually all falls down on you that you think that, you know, I wish I had done that.
Yeah.
So this is something so important. Dr. Kayani is telling us, he's giving us his advice for so many years in this profession, an expert at what he does. He's telling you how you have to, you know, be assertive, take control. Why regret later on in life for those things that you could have prevented? We're talking a lot about blockages and what causes those blockages. So what about blood thinners? Who takes them, and can anyone take them?
No, I think once you are diagnosed with a problem, because they can be injurious, sometimes if you, without the advice of doctor, you start taking it, they may cause you more damage than the benefit. Reason being, we have seen patients coming with a brain bleed, the hemorrhage in the brain, because they had some congenital problems, or we call it aneurysm, right from the birth, and they had no knowledge of that, and those were not diagnosed. And on advice of someone, from friend or not from the doctor,
self-medication.
Yes, self-medication, you start taking the blood thinner or aspirin, and then you land up with the stroke. And then people had a very severe hemorrhage and they died because of this thing. So this is always very important. Once it's advised by the doctor, then you take the aspirin. The aspirin, otherwise we advise those patients who have got all the risk factors. So what are the risk factors? Risk factors are the factors which lead to the heart problem, which lead to the coronary artery blockage. And importance are, if you got a strong family history, you should expect the disease, number one risk factor. Number two is if you got a high cholesterol. High cholesterol means it's more than 200, but this is the European level. Mind you, in Asian levels, in Pakistan, it's less than 200, it's around 150 or 160. It's not 200. We done a study in AFIC, Armed Forces Institute of Cardiology, and we studied good about 35,000 to 40,000 patients. And we were looking into what kind of a cholesterol level these patients have, and they have a heart problem. 90% of those patients, they had their cholesterol level less than 200, within the normal range as per European standards, but they had a heart problem. Only 10% had the cholesterol level which was more than 200. So our cholesterol level is much lower than the Western population. So we have to keep it around 150 milligram per deciliter. So those things are really very important. That's why you keep checking on your lipid profile and your blood test.
How often should a person have that test done?
I think if it's normal, then every 6 months, and if it's abnormal, then every 3 months. And if it's abnormal, then you have to follow the diet and exercise. And if it doesn't come down with the diet and exercise, then on the advice of a doctor, you can take a medicine for that.
Okay.
So once it's advised by the doctor, then you take the medicine. You know, the self-medication.
Statins, are they?
Yes, statins. Yes, statins. But those statins have some side effects as well.
What do they
We
have?
only prescribe those statins to those patients who really need it. not to everyone. And self-medication is very injurious, and those have some kind of side effect. You can damage your liver, you can damage your muscles, you can have a problem with your memory, you can have problem with your sugar levels. Sometimes in prone patients or potential diabetes, if you keep on taking the statins, they can lead to a full-blown kind of diabetes.
Right.
So those things are really very important without the advice of the doctor, because he gauges the risks and the risks of having the side effects, more pronounced side effects, which are otherwise not there in other patients. So if it is needed, then it should be taken. If it's not needed, one should not take it.
Right. Okay, so a person has, high cholesterol or lipids in their blood. What are the fat-busting foods? What should they be concentrating on eating and drinking?
More vegetables and fruits. Those are the natural foods, and they have got the antioxidants.
Are some
and
better
those
than
are
others?
those antioxidants and those elements which are there in the natural food, they actually stop the cholesterol being deposited in the coronary arteries. They stop that chemical process, oxidation, which deposits the cholesterol in the coronary arteries. So that will protection. Not only that, they contain the antioxidants, they have some anti-cancer elements in it as well. If some abnormal cell is there in the body, they home onto that abnormal cell and kill it over there before it it transforms into a cancer. So natural food has the natural remedy for you. So that's the most important thing. They go for the food, maximum fruits, 3 or 4 servings of fruit per day, any fruit.
Any fruit?
Any fruit, could be anything.
Right.
And then vegetables?
Any vegetable?
Any vegetable. No specific vegetable.
Okay, the way we cook our vegetables, we tend to, fry them a lot or whatever. Does that make a difference to their nutritional value?
It does.
Okay, how should we be taking them?
I think it's a semi-cooked kind of a thing, and then not too much of masala into that, and not too much of oil or ghee into that.
Right.
That's really very important. Boiled kind of vegetables are very, very healthy for you. But if you want to give it a taste and some kind of a flavor, then fine, okay.
Right.
You take, but that's the most important thing. You take dal or vegetables, and then if at all you want to take a meat, not more than 3 times a week. That's really very important. And then another thing is the quality of oil you are using. That's really very important.
Can you please get those, because there's so many oils available on the market that people are usually very, very confused. Which are the ones we should be taking?
I think the one who has got the brand and those who have got the quality control. There's no quality control. I think more injurious oils are those which are not being tested and they are being marketed, and mostly the common people who use these oils, they succumb to these heart problems. So I usually prefer the oils which are extracted locally. That is the most important thing.
Local?
Yeah, just the mustard oil, or canola oil, and you have got your extraction plant over there. We used to have in our villages like Kolu or anything like that. They take their own oil. That's the best one, because there's no contamination.
Right.
And there's no adulteration. So that thing is really very. I usually take mustard oil, sarson ka tel, and then if at all, if you are not comfortable with the bazari oils, and then you can always go for the desi ghee, and desi ghee which is prepared in your own house, not someone else.
Right.
Reason being, because it's pure. It does not contain contamination. So small quantity of desi ghee, just a tablespoonful, and the whole food, not more than that for the whole family of 4 to 5.
Okay.
That should be, I think, sufficient. Not more than that. That's good for you.
Right, fantastic. Okay, we're going for a break right now. We'll be back. Don't change the channel. Hello and welcome back to the programme, a programme which I think, personally as well, and I'm sure the viewers have experienced this as well, it's extremely informative. We are very lucky to have Dr. Kayani with us, taking out time from your very, very busy schedule. We have some questions from people posted to status on Facebook. Sayyid Khalid Gilani asks, one question comes to mind: if someone is alone and has a heart attack, what can they do to help oneself until help arrives?
Yeah, I think they can have this emergency kit with them, and they can immediately have the aspirin, Disprin, and it should be taken crushed one, or if you've got a soluble aspirin, you can put it in the water and take that water.
Okay.
Because the crushed and the soluble aspirin acts faster than the usual aspirin if you take the whole tablet. So that's the best way to do it.
Okay.
You crush it and you take it, and then you can always put this tablet under your tongue, and it takes I think 1 or 2 minutes to go into the blood, and then has this beneficial effect on your coronary arteries. They may open up the arteries, and your circulation to the heart is restored, and they can stop actually the heart attack. So those things are really very important. Then this is a patch, and the patch is you put it on the chest, on the left side of your chest, and it contains medicines, and medicine gets absorbed into the blood through that skin, and it has its effects within a few minutes. So you start treating yourself, and you don't lose that time which takes to travel to the hospital, and the immediate treatment starts there, and then you can save yourself, and by the time you reach the hospital, most of the problem is solved, and then if something else needs to be done, that's done in the hospital. Most of the hospitals are not well equipped to treat these patients. So this kit is all the more reason very important for everyone, that you treat yourself, and then you have a time to reach to the nearest hospital, and that hospital which treats the cardiac patient, which has the facilities, which has the expertise to treat the cardiac patient. Because if you lose that time going to the other hospital where they don't have the cardiologist, or you don't have the facilities in the emergency to treat cardiac patient, you lose that time. Instead of losing that time, go to the nearest cardiac hospital where you can have the best treatment available.
Right. And you've also, we were discussing that you have been able to save people's lives with just that kit.
Oh yeah, with that, I think I've been traveling with the Prime Minister, and during the flights we had problems. We had the heart attacks, we had the cardiac arrest, and we have been able to manage to save them. Alhamdulillah, I think that's really
fantastic.
that's fantastic. It does work. It does work.
That's great.
Instead of doing nothing and waiting for some, I think, kind of
for a miracle to happen,
emergency, and then it helps a lot. So it should be available with everyone.
That's fantastic. So there's that answer. We discussed it before as well, how important that emergency kit is. I mean, it's just it's so small and easy, compact to carry around anyway, really no excuse for anyone. And at the end of the day, it's something that is life-saving. Okay, Dr. Tahmina Rahman is asking, what are the options for non-affording people? Can fees be waived? And also medicines and stents that are very expensive, what provisions do they have?
I think our hospital is such a model where we're treating, I think, 85 to 90% of the patient free of cost. And anyone can walk in, and we have got a evaluation system, and it's a very quick one. If there's an emergency, there's no evaluation. Okay, we can evaluate later. You get the emergency treatment, and we can evaluate later. And if you are affording, you can contribute. If you're not affording, then it's free of cost. So this thing is very important. The emergency is the most important. The life is very important for us. And it's only the RIC, Royal Peninsula Cardiology, is the model. And we are getting sufficient funds and the budget, and we are treating the patient like that. I mean, if someone Rediwala comes in and some Mazdoor comes to my hospital, and then the rickshawala or taxiwala comes to my hospital, we don't ask him the money. Just walk in. The treatment is, emergency is totally free. You just walk in, get your treatment, walk out of the hospital. And if there is some major procedure to be done, then you evaluate the patient for that. Otherwise, you get free medicines. We have got free medicine, and there's no medical store outside my hospital, because we don't give check to the patient, get this medicine. We provide the medicine within the hospital.
That's fantastic.
So that's really very good, and this is the kind of hospital which is providing the, I think, great service to the community. And you can, this is free for all. And I think offer these services to everyone who's watching this program. That anyone who's poor, who can't afford it, I mean, to diagnose this disease costs you 50,000 rupees. And then the treatment is much more expensive than this one. This is in lakhs. And maybe 2 lakhs, 3 lakhs, 4 lakhs, or 5 lakhs. So you can just walk in, get your treatment. You don't have to request anyone. You say, I can't afford it. Okay, we have got the system, and we can evaluate it. And if there is emergency, right there and then, within few minutes, the decision is made, and patient is taken to the operation theatre, is taken to the cath lab for the treatment. without taking a single penny from him.
Right, okay, that's absolutely fantastic. Again, you know, such valuable information there. The Rawalpindi Institute of Cardiology, where Dr. Kayani is saying that free of cost, somebody who can't afford treatment, because what greater tragedy is there for somebody to be in an emergency situation and not having the money to be able to save their life or a loved one's life. That's absolutely
Most of the patients, they are discouraged and they don't come to the hospital because of the expenditure involved in the treatment. So I think this thing is there, and now people have practiced it, and we are doing it since 2012, September 2012. And most of the patients, they benefit, and I think that they're so happy with the hospital. And we have got the best team, the medical team, the paramedics, the nurses and the doctors, and they're all professionals, and they're all been recruited on their own merit.
Fantastic.
No swarage from anywhere.
That's absolutely.
And no political interference from any side. That's why I think it's become the best model now.
Of course, of course. Zishan is asking, for a normal person, what's the easiest way to check the health of their heart?
I think anyone who's more than 20 or so should have his blood test checked every year, including your lipid profile, your cholesterol, your fat levels, your sugar, your kidney functions, your liver functions, and then should have his echocardiogram or ultrasound or stress test, ETT test, once in a year. That's really very important. I think 30% of the patients, they don't have the symptoms. They don't have the chest pain, they don't have the warning symptoms.
Okay.
So the only way to identify those or diagnose those patients is by having these tests. So once these tests are done, if there's something abnormal in those tests, then we'll go ahead and do other tests as well. But these things are the preliminary screening tests which should be done in every individual who's more than 20 years old.
And imagine at 20 you just don't think that way.
Yeah, you don't think that way. But I think since I quoted you a few examples that we are getting these patients in these ages.
Right.
So at this age group.
Again, that is another eye-opener from the age of 20, which we just think is such a young age, and we don't think
because we have been seeing and we have been treating those patients in 20s in the coronary care unit with a heart attack. Unthinkable in the West. And unless you have got a familial history and you've got a very high cholesterol, there are very few cases who have got a family history of having the very high cholesterol levels, which causes it blocks all kind of arteries, not only your heart, your brain, your kidneys, and those carotid arteries, and they cause strokes. But those are different group of people. This is the normal, I'm talking about the normal population.
Right. And
so this is really very important.
Is this yearly? A person yearly should have this done. Okay. Asan Chaudhary is asking is that omega-3 supplements, we can take them in fish oil tablets. Are they helpful for the heart? Do they help?
Only for those who have the heart problem.
Okay.
Not for the primary prevention.
Right.
So I think you have a simple diet. You have more of vegetables and fruits, and that prevents your disease. You don't need to take extra capsules or extra tablets, or those are all candies. Why not to have a normal, simple food and exercise and control your weight and stop smoking? Smoking is #1 killer.
Okay.
That's the most important thing. Those who continue to smoke, who have heart problem, they will have another heart attack after a few months or so. And if you put in a stent, if you do the bypass, the stents will get blocked, and their other arteries will get blocked, and the bypass, they'll stop functioning. So this is very important that if you are a smoker, you should try to smoke it right from today onwards. This is very important. This is #1 killer, and this I think increases the speed of progression of the disease. So this is really very important.
For people who are trying to quit smoking, patches and
they do help.
other
I think
things.
Once you make up the decision and you're strong enough,
willpower.
So stick to it. Yeah, willpower is the most important thing. Yeah, most of the people they do like that, and they're very successful. Once they say, okay, this has happened to me and I have to stop it, they stop it altogether. And then if you have any problem and you think, then you could take the help of these chewing gums or the patches.
Okay.
They do help because you have a withdrawal symptoms of the nicotine once you stop smoking. Then the nicotine level drops and you become jittery and irritable. So to help those kind of symptoms, you can use the chewing gums and then the patches as well.
Right. Culture, lifestyles, many things are sort of like, they add up to the bigger picture. We see a lot of, people are less active, physically active. Social media has made a person sort of sitting in one place. It's ironic that you are physically not being social, but you're social just being by yourself. You're absorbing a lot of emotions because you're witnessing things happening on social media. Then junk food. To tell some some people who are really, really, addicted to junk food and that, what would be a safe guideline for them? Because, if you can't do without it, then how much should you be having in a week or a month?
Once in a month or once in 2 months, yeah, that's how it should be.
Okay.
And you should avoid, I think it should not be a regular feature kind of thing. You should stop your children consuming these kind of food, because they have brought this kind of food, the junk food has brought diseases to even to the Japan, which has 20 times less heart problems than as compared to the rest of the world. Where they have this McDonald's and there's this KFC, and they have now the area living around that area, and those who are consuming those foods, they shifted to that kind of food. They're having more heart attacks than the rest of the Japanese.
And that's how dangerous it is.
This is very dangerous.
Such an eye-opener.
Yeah, it's an eye-opener. It's such a fine fat. If you take this fast food, it immediately goes into your blood and makes the sludge, and your blood becomes thicker for a few hours, and you have another binge of that kind of a food again, and then you can clog your arteries right there and then, and you can have stroke, and you can have heart attack, or you can have a clots in your eyes, and you can lose your sight. So those things are really very important. And I think we should be very, very careful as far as children are concerned. And once in a while, okay, fine, but once they have done that, then should exercise and try to burn all those calories which they have consumed. I mean, you need 1,000 to 1,500 calories per day, and if you take one meal in the fast food restaurant, then you consume in one meal, and then it's very difficult to get rid of that fat and those calories that they immediately deposit in your body and then increase your weight. The other thing very important is that the warning sign is the increasing size of your waist. That is very important. The upper limit, the red line is 38 inches for the men and 34 inches for the females.
Okay.
So once it's more than that, then you are liable to have the heart attack. Ideally is 36 inches for the men and 32 inches for the females. But the last limit is 38. And the 34. So once, keep watching your waist. That's the best thing to watch yourself. And if it's more than that, I think start to control it and reduce it. And do exercise, eat less, do more physical activity. And instead of using the, I think, motorized kind of a transport, you can walk. Yeah, that's the most important thing.
Which unfortunately we don't do.
Yeah.
We'll park our car in front of
the shop.
In front of a shop, and we won't even be happy at parking it a few, yards or feet away from the shop.
Culture is,
We'll want it exactly in front, so that we just walk a minute number of steps to get into that. Again, culture, the mindset. We need to come out of this mindset and change so many things drastically.
I've been running a free clinic in my village since I was a captain. That is, I think, since 1980. And I've been going there, seeing free clinics, and then giving these kind of talks to those people, and that has made a great difference on those people. I heard now most of the people in my area, in the village area, the villages around my village, they have started walking, they have started exercising, they have started taking the healthy food, they have stopped smoking, and the incidence of disease has dropped down.
That's fantastic.
So that's really very important, that hammering this thing time and again and again, and then educating the masses about how to keep yourself away from this disease and how to prevent this disease.
It all starts at home as well.
Yeah, it does.
The climate that you have at home, if as parents you're indulging in this unhealthy activity, then your children are going to think that this is normal and it's okay. So again, a huge responsibility that we have as parents and in the home as well. Okay, tell us about male versus female and heart disease. What are the differences percentage-wise or ratio, and are women just as equally susceptible to heart disease or heart attack as their male counterparts?
It's more on the male side, and the 30% in the males, and then if you take the disease, that's, I think 70% in the male and 30% in the females.
Okay.
And the females are, as such, they are naturally protected because of the hormones in the body which are released before the age of 45 and premenstrual age. Those are protected. Once that age is over, the risk becomes equal. So that protection is gone.
Okay.
So I think one should be very, very careful. I mean, the best thing is exercise, keep your weight under control, have a good sleep, and no extra stresses.
Right. Okay. Let's talk about emotions, because we hear so many times, the poets have written about it, the writers write about it, the effects of sadness, grief on the heart. What is the relationship, and can a person actually die of a broken heart?
Yes, it's proven by trials, different trials, that anxiety and depression, they have a negative effect on the heart. They are more prone to have the heart attacks, and if they have the heart attacks, more people with depression, anxiety die as compared to the normal people who don't have the anxiety or depression. So it does have a very, very harmful effect on the heart. So it does have, I mean, it secretes so many hormones very injurious to the heart, and which cause more mortality or more killing than the normal people. So this is very important. I think the thing is, the kind of stress we have in our life, in our part of the world and this culture, is unnecessary stress.
Well, exactly.
Unnecessary stress,
Exactly.
which can be easily avoided.
That's so
and
true.
we actually, I think, jump into that kind of stress, which you can always avoid. I think it's very, very important that the stress for everyone is always there.
Yeah.
And you should know how to manage it.
You can't live without stress.
You can't live without stress. It's everywhere, but you should know how to manage it. That's the most important thing.
Exactly.
Yeah.
So, okay, as you just said, you know, an example of that is our weddings. It's supposed to be a festive, happy occasion, but usually what we'll see is the people at home and also the bride and the groom, everyone is under so much stress because of these added complications that we have created.
Which are usually not required.
Exactly.
Unnecessary stresses.
Exactly. That's so true. Dr. Kayani, thank you so much for taking out your time and being with us here today. It's been such a valuable program. I have learnt so much, and I'm sure the viewers have had countless bits of advice that everyone can adhere to. Thank you very much for joining us here today. Okay, so with that, we come to the end of today's program. It's been a very, very important program, you know, so for most of us, it should be a wake-up call in that you understand why wait for something to come your way, having a miserable outcome afterwards when there are so many things that are preventable. So stay happy, stay healthy. See you next week. Bye-bye.